Royal Mail Group has worked with national charity Mental Health Foundation to produce a series of short films about mental health and well-being for staff. This film explores the link between long-term physical health conditions and mental health, and the things that you can do to support yourself and others.
Long-term conditions can mean a whole range of things. Sometimes it's something you're born with, like diabetes or epilepsy, or it can be something that you experience as you get older in life. So it could be a result of ageing or a result of an injury.
When I was diagnosed with a heart problem, I was knocked sideways. I was in my early 50s. It was just something which was so completely gobsmacking, as they say, in my life. I became very fragile, very anxious, felt vulnerable.
Your mind and body are so interlinked. Having a long-term condition can impact on your mental health, and having a mental health problem can lead to long-term conditions.
When 6 o'clock on a Friday evening came and the local GP's practice was closed, I started to get edgy. Who was going to look after me that weekend? When snow started to fall on the ground outside, would an ambulance get down the street to pick me up? For about 6 or 7 months, I found it difficult to go out of the house. I felt that vulnerable and anxious.
The most important thing is being aware that actually living with a long-term condition is one of the most stressful things that we can do.
After I'd had the operation, I still felt anxious, so tense, developed stomach problems, headaches, you name it. And I never thought I'd get better.
Being very protective of your mental health and being aware that there could be points when you need support.
The most important support came from family, friends and colleagues at work, listening carefully to what I had to say because it was new to them to hear these sorts of things coming from my mouth, and as much encouragement as they could. One of the most important things to do is to speak about it, talk about it, to anybody who will listen, but most importantly to your GP, because your GP might be able to help immediately.
Your GP should have lots of guidance and support to offer. Equally, practice nurses are able to offer support. However, there's a lot of online resources available to people, not just leaflets and guidance and information, but there are a lot of online groups that people can join and get support.
It's always useful to hear from somebody who suffered from the same thing that you're now suffering from. And listening to their experience is so invaluable. Just having a conversation, sort of, if you like, peer support, has been very valuable.
The most important thing about going back to work is that it does give you a sense of purpose in your day and something outside of the long-term conditions to focus on, as well as it actually being a place where you can meet other people and gain support. One key thing that managers can do is actually to support people in their own self-management plans. If exercise is an important factor in managing something like a heart condition, that managers look to see if there are things that they can put in place to support that in the workplace.
I feel great now. I feel privileged that I got through it all and happy to help others.